Hi, I'm Dr. Amitabh Banerjee. I am an epidemiologist and author of COVID-19 Pandemic, A Third Eye. Today, I'll be discussing chapter 5 of this book. This is a very important chapter because this can happen again. This deals with the ethical violations and human rights violations during the pandemic, and we will just see what way knee-jerk reactions throughout the world violated many ethical principles. The title of this chapter is Government Jumped Several Red Lights Dealing with COVID. I have tried to compare this with the traffic signals, that there are some traffic signals which warns you to go slow, and just as chaotic is our traffic, so similar chaos was observed during the responses. So the summary of the chapter is the pandemic of COVID-19 led to a cascade of knee-jerk draconian measures by most countries of the world. The panic permeated the psyche of populations. There was a public panic and the psyche of populations, rendering them compliant to virtual house arrest. All of you may identify with this virtual house arrest. In this chaos and anarchy, almost all the ethical principles such as equity, beneficence, non-maleficence, and autonomy were breached. There are basically four principles of ethics and human rights. First is equity, that is justice. Everybody should be treated equally, the rich, poor, there should be no discrimination. Beneficence, there should be some benefit of the actions you are taking. Non-maleficence means first do no harm, and autonomy means your consent, your right to take decision concerning your own welfare or health. So what happened during the COVID? COVID-19 brought to focus that we have forgotten the lessons of social medicine, painstakingly learned after the scientific world realized some of the limitations of the dogma of the germ theory of disease. Medicine made great advances after identification of bacteria, viruses, and but sometimes they go into over optimistic high expectations, like when the germ theory of disease followed the discoveries of Robert Koch and Louis Pasteur in the 19th century. After the initial euphoria, it was realized that besides bacteria and viruses, there are several offshoots of infectious diseases. I mean, just virus and bacteria, when initially in the heady days of germ theory, we were very optimistic that we will eradicate all the germs, we will control communicable diseases. But later, it was realized it is not so easy. There are many interlinked factors. This looking piecemeal only at the virus or only at the bacteria does not help, does not improve the population health. Diseases have social causes, social pathologies, and social consequences. That was the rise of social medicine beyond the germ theory. The road to social welfare consists of ethical red lights as safeguards from collateral harm. In our over enthusiasm, like medical scientists get, sometimes they fall in love with their discoveries and they rush headlong. And to control that, there are certain ethical red lights. Like every scientific research has to pass through ethics, which has a people from all walks of life, lay persons, from social sciences, from legal aspects. So even a small research in an institution has these safeguards. So it was very strange that such large scale population interventions, so many ethical red lights, safeguards were overlooked, causing collateral harm. In this pandemic, all the red lights of ethics, that is equity, beneficence, non-maleficence, and autonomy were ignored. One by one, we will just discuss How each principles were ignored? Equity or justice means that each person's interest should count equally. This is by logic should also apply that all disease person, irrespective of the diagnosis, should have equal and easy access to health services. Equity can be extended to different sufferers from different diseases. Each disease which is a public health problem should get equal attention. In India, we have a large burden of communicable diseases and an unacceptable level of maternal and child health problems. We have people who are suffering and who are dying from many other conditions. 2,000 children die from malnutrition related infections or deprivation every day. 1,400 people die every day from tuberculosis throughout year after year. So these are also diseases which should give equal attention. So the equity, I have quoted some figures. Every year, 8 lakh under 5 children die in India from preventable disease. 8 lakh children die every year in India. And COVID death rate in 3 years have not crossed 5 lakh. And most of them were elderly with comorbidities. Of course, that is also sad. But children death are bigger tragedies in the prime of life. 8 lakh children under 5 die in India every year. The risk of a newborn dying before the first birthday in India is 3%. 3% of newborns die before they reach their first birthday. This is more than the infection fatality rate from COVID, which recent estimates put at far less than 0.1%. And in children, it is negligible, zero. Most of the neglected endemic diseases and child mortality are diseases of the poor. These are the diseases of the poor, while the perceived threat of COVID-19 is felt more by the upwardly mobile, globe-trotting middle class. There is a clear demarcation between the diseases of the poor and diseases of the rich. The principle of equity is ignored. Even during the waves of COVID, the poor people were just packed into their slums, into their tenements, and they survived because they had developed immunity much faster because of crowded conditions. Dharavi did not have a second wave. And the middle class and all, they isolated themselves. They did not suffer at all. They isolated themselves. And then second wave, they were found vulnerable. That's a different story. The rollout of the much awaited vaccines further revealed these inequalities. At the global level, rich countries had unlimited vaccine supplies while the poor countries struggled to procure adequate supplies. Within the country, there is an urban-rural divide in access to vaccines. There were reports of people from cities going to villages to get vaccinated, depriving the uninformed rural residents of access to the vaccine. This happened when there was a scramble for vaccines. And as irony would have it, countries which did not get the vaccines like Africa and all, the vaccination coverage was less than 5%, they fared much better. So that it was a perceived that vaccine is a panacea, it will just kavach, it is an armor which will give you solid protection. So it failed. But had the vaccines been effective, the countries deprived of the vaccines, in principle, the intent to discriminate was there. So it was an irony that they did not suffer much. Under vaccinated areas did not suffer much in this pandemic. But in the future pandemics, if this discrimination is there, then this is a violation of ethical principles. But intent was there. Beneficence and non-maleficence, benefit and harms. The ethical principle of beneficence implies that people should benefit from any intervention and risk-benefit ratio should be acceptable. In this case, in this crisis, lockdown was one of the greatest population-level interventions. For the poor, the risk of fatality from contracting COVID was far less than the risk of fatality from any of the other diseases of poverty which are endemic in India. Lockdowns pushed people to extreme poverty and misery. COVID malnutrition and child deaths rose exponentially. No fancy models from overrated foreign universities were needed to predict this. Non-maleficence means to do no harm. This is an important ethical principle of any intervention. The greatest harm in the lockdown, with hardly any benefit, was imposed on the marginalized section of the population. According to the latest census, more than 6.4 crores of Indians' population stay in slums. This is almost equal to the population of UK or France. Anyone who has visited a slum in India will know that social distancing or frequent hand washing is just not possible for these marginalized people. Most of them share common community toilets with scant water and hand washing facilities. Cooped up 24 hours in crowded living conditions would be the ideal situation for spread of respiratory infections besides other communicable diseases. So again, it was an irony in spite of their being pushed inside during lockdown. They did not suffer from COVID, but they lost their livelihoods. I mean, it did not help them. There was no, it harmed their business, they harmed their livelihoods. They would have been outside vendors in the open, they would be carrying out their business. They lost their business. And they did not, the middle class did not suffer at all. They were working from home. A feature in New York Times dated 26th May 2021 reveals how the Center for Disease Control CDC Atlanta, USA misinterpreted a scientific paper to conclude that risk of COVID transmission outdoors is 10%. This was a misinterpretation of science. This led to advice to stay indoors and wearing of masks when stepping outdoors. We all must be remembering the caller tunes. कि बाहर जाएंगे तो मास्क पहना है. Put on the mask when you go outside. So this was again a very, illogical and unscientific. Outdoor transmission is almost negligible. Indoor, I mean, subsequently, one of the authors of the paper tweeted that the risk of outdoor transmission was less than 0.1% and not 10% as reported by CDC, which overestimated the risk of outdoor transmission hundredfold. This fundamental error led to restriction of outdoor activities worldwide and caller tunes urging us not to step outdoors. The American CDC being the bellwether for global mandates on COVID-19. So a misinterpretation of data by CDC may be deliberate or oversight, we don't know, but they did not change the guidelines. After the lead author of the paper pointed out that the outdoor transmission was 0.1%, wasn't 10%, as reported by CDC. The co-author of the misinterpreted paper, Nusin Razani, further tweeted, co-author was Nusin Razani, further tweeted, people should spend more time outdoors to enjoy nature and be active. Being outdoors is essentially the best ventilation one could ever imagine, as particles have the space to infinitely dilute, disperse, and eventually and essentially disappear. In a subsequent interview, she mentioned that the outdoors is the best resource and we should find ways to undertake more activities outdoors. In spite of this clarification by one of the authors of the paper on which the CDC based its recommendation to stay indoors, the august body and global consensus continued to treat outdoor activities as a major risk. We all know we were not allowed to step out the houses. Beaches were closed. Outdoor businesses were closed. I mean, strange. Had CDC followed the science correctly, it would not have continued to recommend restrictions of outdoor activities and businesses. The cascade effect made other countries to follow suit and shut down all outdoor activities and businesses whenever there was surge in cases. This led to severe economic hardships, particularly in developing countries where most people in the unorganized sector work outdoors. The irony is that in developing countries, poor workers were pushed indoors in their crowded living conditions where they were more exposed to infections and, to add insult to injury, lost their livelihoods, most of which were pursued in safer outdoor environments. These included hawkers, mall traders on the roadside, open street food restaurants, owners, and so on. If we had followed the science, we could have ensured interruption of transmission, which occurs predominantly indoors, and also preserved livelihoods which depend on outdoor work. So we killed two stones. I mean, with one stone, we killed two birds. We killed the businesses and we let the infection also spread widely. It's another thing that because being a young population, low risk population, we did not have high mortality, but the indirect effect of losing business and the diseases of misery or diseases of poverty would indirectly add to the higher collateral deaths. Then what about autonomy or informed consent, the fourth principle? The greatest lockdown in the world was announced with good intentions at a notice of 4 hours in our country. Economists, social scientists, and others were not given an opportunity in the public forum to voice their concerns. There was no public debate of the pros and cons of this draconian measure on such a large scale. Even if you give an option to an individual patient, you weigh the pros and cons. Here, no debate was there. No economist or social scientist came forward to say, or they were not allowed to come forward to say the collateral harm to calculate the major intervention. What would have been the benefit? Hundreds of lives and livelihoods continued to be at stake and vulnerable to the ravages of unemployment, hunger, and starvation deaths of despair. The Epidemic Disease Act 1897 from the colonial times enacted to fight the plague was enforced, giving enormous powers to the state and suspension of many basic human rights. This was used to tackle a 21st century disease which should have been addressed by science and evidence rather than converting most countries into police states. We are in the 21st century. Even in the times of great pandemics in the past, like plague and smallpox, we never had such draconian measures. And this was a disease which was for the most healthy people and young people was self-limiting. These ethical oversights need to be deliberated so that future pandemics do not evoke such clumsy and crude responses with the remedy worse than the problem. This is very important. At this time, there should be a proper introspection of what all these violations, ethical principles were violated, human rights were violated, there was collateral harm, and instead of that, we are facing a threat of not the next pandemic, whatever that be, but we are facing the threat of intervention without a pandemic, without a real pandemic. We are facing the future threat of a pandemic treaty, WHO pandemic treaty, and the amendments, over 300 amendments to the International Health Regulation. International Health Regulation is a 90-page document in which 300 amendments have been proposed, and a treaty has been proposed for all the member countries of the WHO to sign. Perhaps part of it has also been pushed through. And if you can imagine that we faced such hardships, we faced such violations of human rights without a treaty. So one can just imagine if the treaty comes into force, what will be of fate. The bureaucrats will take over, the administrators will take over, the police state will take over. And as I have said, this Epidemic Disease Act was in colonial times, this became the model. And the treaty is going to be much more harsh and restriction of human rights compared to even colonial times. And the provisions in the treaty are that there will be complete censorship. Nobody can discuss anything. Even now, it was like that. Mainstream, whatever, anything question was labeled as misinformation, whereas I have just given few examples. There was so much misinformation from the august bodies like the CDC about outdoor transmission. Earlier, I have discussed about mask also, about that it's not safe to step out. You have to wear mask. So they're not based on science. So if you really analyze it deeply, these were more misinformation. And anybody would question that, they were censored and deplatformed. So this was without the treaty. So I would like all citizens of the world to introspect and to ask the questions and to really do their homework, because the organizational systems all over the world are making it into a more of a restrictive, or it will almost like a police state. I mean, you saw the extraordinary powers given to the police force, some countries where they had full year to curb all activities, to step outside, to question anything. So this is a very grim warning, and we have to ask for the science behind all the measures. It is good. One should have a system to control pandemics, to mitigate human suffering, but it should be done with all people on board, not only one group of scientists, one group of bureaucrats, one group of policymakers, without any transparency, and the censorship and suspension of human rights are never indicated in the 21st century, where medicine has advanced much, where there cannot be a situation where people will die from pandemics and are large numbers, particularly young and the healthy. Even in this pandemic, COVID pandemic, which is considered as a pandemic of the century, hardly any impact was on the young and healthy and children. So elderly are always vulnerable. So in future pandemics, also the vulnerable, this blanket treaties and blanket regulations will harm and cause a lot of social fracture. It will fracture society. So that's all I want to convey in this chapter. Thank you.